name's Allison Charney Hussey. I'm the Executive Director here at CROW, the Clinic for the Rehabilitation of Wildlife. And as Executive Director, I oversee the entire organization from an administrative standpoint. CROW is a very unique nonprofit to Southwest Florida. You know, we're the only wildlife animal hospital in Lee County, and really things that we take care of here, animals that we take care of here, sea turtles, for example. We're the only licensed sea turtle facility between Sarasota and the Keys. So we are unique in the fact that not only are we caring for the wildlife, but we're also a teaching hospital. And so students can come and learn about how to become future wildlife veterinarians or rehabilitation experts. Our mission of saving wildlife extends beyond the hospital. It's here in the Visitor Education Center, and it's when we go out on programs and talking to students. So that I think sets us apart from the other nonprofits in Southwest Florida. Wildlife rehabilitation is important and should be important to each and every one of us.
So my name is Brittany. I'm the Education Outreach Coordinator here at CROW. I talk to schools, I go to universities, I go to community events such as Burrowing Owl Festival, where I share what CROW does as a wildlife hospital. I start with animal care. I'm responsible for the ambassador animals in the visitor center. Right now, we only have our 3 snakes up here. So those are a ball python, a corn snake, and an eastern indigo snake. I lead tours alongside our education intern, Jordan. Those tours are roughly an hour, and we just talk about CROW and what we do. However, it's really important that we utilize our education center in a way that is going to get the attention of people, not just in the moment, but to get them to want to continue to pay attention to conservation efforts, our wildlife. Our visitor center, we have all sorts of information back here. People love to hear about patients, but through all the interesting things, our snakes, we're able to sneak in some education as well as some ways that people can better help our wildlife.
Well, my name is Dr. Taylor Lashley. I graduated from the University of Tennessee, both undergraduate and vet school, and I've been doing exotics and wildlife practice for the past 3 years now. Our typical day, we come in, we start with taking care of our inpatients that we already have in the hospital. So whether or not that's doing checks, feeding them, getting their medications, and just going through making sure everyone's doing well. And then usually we have our intakes that all come in at around the same time, around midday. And so we do a triage, we work them up, then we start medications on them, and we make a plan of how we want to treat them, and we try to figure out what's going on with them. Then we also have our patients outside who are with our rehab facility, so they're out most of the time doing conditioning, so trying to get a little bit more endurance before we release them to the wild. So we get a lot of unknown trauma here in the wildlife hospital, whether or not it's like a broken bone, we get a lot of those, or with our turtles, we get a lot of broken shells. So a lot of times when they're found in the road, we assume that they're hit by a car, or even like people will see them be hit by a car. So we do commonly see that. So we get a lot of like fractures that we have to deal with. So we use a lot of supportive care and antibiotics as needed. So when an animal comes in, if they have an open wound, open fractures, or if when we do blood work that seems like they have signs of infection, we'll usually put them on just a broad spectrum of antibiotic usually. And then we also do a lot of pain management, so different pain managements with a lot of times NSAIDs if they're well hydrated, or opioids for those with really painful conditions such as broken bones, and then we also try to do a lot of supportive care, so a lot of fluids such as subcutaneous fluids or IV fluids if they're really debilitated. And we also do a lot of force feeding, so some of our animals can't eat yet or they're too sick and they don't want to eat, so we do a lot of that to make sure that they're keeping their calories high and they're keeping up their nutrition as well.